Hey everybody, welcome back to theclinicaltrialsguru.com. Again, that website address is theclinicaltrialsguru.com. I got a very interesting question slash topic, and I don't have the question in front of me, but I remember what it was about. And it's about principal investigators and their sometimes unrealistic expectation as far as compensation for doing a trial. So I actually get this question asked a lot, and it's kind of like a question slash complaint, uh, different forms. So I get the same thing over in different type of forms. Sometimes they're questions, sometimes they're people venting. And by the way, email all your questions, Dan at theclinicaltrialsguru.com. Dan at theclinicaltrialsguru.com. I'll keep you absolutely anonymous unless you specifically ask to be mentioned. So PIs and their unrealistic expectations in regards to compensation in a clinical trial. So a lot of research clinics are owned by non-MDs. They're owned by study coordinators. They're just owned by business people. They have to hire MDs. They have to hire doctors to be their principal investigators and conduct their studies. So obviously they get into some kind of negotiation where they'll say, I'll pay you X amount of dollars, or I'll pay you X amount of percentage, and then you'll do the studies. I think the issue stems from these PIs that are being hired for a research clinic when compared to PIs that own the research clinic. So the expectations are different. A lot of the PIs who get hired by research clinics are not owners, but they see what their colleagues who own research clinics make, or they see what kind of cars they drive, they see that they're doing very well, and they say, okay, I want to do the same. But what they're forgetting is that they're not taking on any of the risk associated with being in business. They're just an employee or a contractor at that point. So you get into situations where PIs who don't own the clinic ask for like $100,000 salary for a year from a startup research clinic, who basically, if you do that to a startup research clinic, you are going to be killing them. I mean, if you charge that much to a research clinic who's just started and just has like one or two studies, that research clinic is going to be hemorrhaging cash. What you don't see, and what these MDs usually don't see, is that their PI counterparts who own research clinics sacrifice years of not paying themselves anything, or years of putting money into the business in order to be profitable later. So I see both sides of the story, and I hear from both parties all the time. But the PIs who have unrealistic expectations usually, if not always, are the ones who are not the owners of the clinic or of the company. They're usually employees or contractors. Another thing is, research is perfect as a side gig for a lot of doctors. So a lot of doctors don't mind making an extra $50,000 to $60,000 a year working for a startup research clinic, with the expectation that maybe when the site gets busier and more profitable, they would make more money as an employee or as a contractor when the research clinic gets more profitable. On the other hand, you have the PIs who own the research clinics. They're usually putting in their entire like 40 hours a week or more, even if they have to work other jobs to support or sometimes finance the research clinic. They're still putting in their time. So a lot of the doctors, that's another issue where the PIs, principal investigators, who are not research clinic owners, may have a differing perspective as opposed to the MDs who are research clinic owners. So hopefully this helps. There is a disconnect there from the MD community and the PI community, and I think at the heart of the issue, that's what it is they don't see the amount of time it takes to actually generate a profit. In a research clinic, if you're just starting from the ground up, you need a year to be profitable, at least. And that's if you know what you're doing. If you don't know what you're doing, you may need 2 years or more, or you might just go out of business. And a lot of these research clinics who have no option but to pay these PIs who they hire 80, $100,000 a year when they have like no studies and no way to possibly pay those. They finance everything on credit card or debt, end up going out of business. And those PIs, if they're smart, they see that and they can create their own clinic, or they'll go work for another clinic and do the same thing. So there is a huge disconnect, and I think that's where the problem stems. PIs, MDs, if you're watching this and thinking about getting into research, I mean, I'm not saying it's impossible to get 6 figures a year doing research, but you'll have to work for a more established company. And you can make a lot more as an owner. You're always going to make a lot more as a research clinic owner than as an employee. But that's generally what I've been hearing from the sites, and I've been seeing myself with my own 2 eyes and my own 2 ears. Thank you for watching, guys, and stay tuned for more posts on theclinicaltrialsguru.com. Thank you.